Good afternoon, everyone. Welcome to FEMA's Region 4 webinar series, A More Resilient Tomorrow. In this webinar, we're doing how communities are adapting to extreme heat. Before we start, I do want to bring up a couple housekeeping notes. There is a Q&A function that will be at the end. If you have any questions, feel free to put them into the chat throughout. We'll make sure that is answered at the end. There's also closed captioning available through Zoom. If you like, that should be at the bottom of your screen. I'd also like to thank the Mississippi-Alabama Sea Grant Consortium for being our partner in this webinar series. They've been a wonderful help, and this will be available afterwards on their YouTube page. And we'll start with the webinar. And so our today's presenters, we have Jane Gilbert, who's the Chief Heat Officer, the first in the nation for Miami-Dade County. We also have two people from the National Weather Service. We have Kimberly McMahon, who's the Public Weather Services Program Manager and National Integrated Heat Health Information System Co-Lead, and Donald Harrigan, who's the Science and Operations Officer. And we will start with Jane.
Good afternoon, and I'm going to share my screen. It is a pleasure to speak with you all this afternoon. Hold on one second. Let me get to slideshow. Why is it not allowing me to go to slideshow? Huh. There we go. All right, great. Oh, I can't see it. Oh, there we go. Okay. So great to address this audience today. Our local partnership in Miami-Dade County with our own emergency management department has been nothing short of incredibly rewarding, and we'll get into a little bit of how we do that here locally as I go on with my presentation. But 3 years ago, our mayor, Daniela Levine Cava, appointed me as Chief Heat Officer to address the increasing health risks and economic burdens associated with extreme heat here in Miami-Dade County. Miami and South Florida were known internationally for our risks to sea level rise and hurricane risk. And collectively, our emergency department, our offices of resilience have been working on those issues for quite some time. But in 2020, a group of community-based organizations did a series of focus groups and surveys in low-income, moderate-income communities throughout Miami-Dade County to better understand what people's top concerns were related to climate change. And it wasn't sea level rise, and it wasn't even hurricanes, even though we had recently had Hurricane Irma, and those communities were hit pretty hard. But it was extreme heat, because that's what people were experiencing day in and day out, whether it was rising utility bills, difficulty in repairing an HVAC system in the middle of July when it breaks down, maybe exposure at the workplace, maybe their kids can't play outside as much. All of this were impacts that they were feeling in their lives. And so it was really inspired out of that, as well as the county's partnership with the International Archrock Resilience Center, who has had a focus on extreme heat in cities, that the idea of a chief heat officer to work across departments and with external stakeholders to look at short, medium, and long-term ways to address the increasing health risks and economic burdens with extreme heat. So that was my charge. As you have more than heard in the news, extreme heat is the leading weather-related death nationwide, worldwide, and here in the southeastern United States. Actual recorded deaths average around 700 a year, according to the CDC, but we know that's grossly underreported. Maricopa County alone had 600 last summer because they have a more robust way of capturing those deaths. In Florida alone, we've had average of over 6,000 emergency department visits. And that's just the tip of the iceberg, because that's just heat exhaustion, heat stroke. It does not include that heart attack that might have been caused by heat, the preterm birth or negative birth outcome that may have been caused by heat, the construction site fall off a ladder because someone was dizzy from the heat, a pediatric asthma outbreak instigated by the heat. There are many other ways that heat is impacting health outcomes. And we did 2 different excess heat-related studies here in South Florida. And even though the actual recorded deaths are under one hand in number, in average here, using the same 5 years from 2015 to 2019, if you look at it just on high heat days, we have about 34 deaths a year in that time frame. But if you also look at the lag effect of heat exposure, there's an increase of 600 deaths a year in Miami-Dade County alone. So those are some of just the wide range of how much we don't know about the full extent of the heat impacts. And it's also significant economic impact. The Archrock Resilience Center commissioned a study from McKinsey and Vivid Economics for many cities worldwide, including the Miami metropolitan area. And it was estimated that our current annual economic impact is $10 billion a year due to labor productivity alone. That includes health impacts, injuries, but also lost labor time. And that is projected to double by mid-century. So what is extreme heat? It's really any time where we have a heat index exceeding 90 degrees, which in the southeastern United States can be many days of the year, for at least 2 to 3 days. Of course, we are more acclimatized to that high heat and humidity, but it's still, if you're exerting a lot of energy, if you are particularly sensitive to heat, at a heat index of 90 is when we really need to start taking precautions to prevent heat illnesses or death. And then the risks go higher as you get to higher temperatures. And we're going to get into these all about how extreme heat is rising, both due to climate change and how we're developing as cities. And the good news, and really the reason for this work, is that we can prevent these heat illnesses and deaths largely through education and different policies. It does not impact, we're all at risk, but it does not impact us all equally. Certain people are more sensitive, older adults, very young children, pregnant people, people with heart or lung conditions, people on certain psychiatric medicines. All of them are more sensitive to heat and its impacts. And then there are people who are more exposed. We mentioned low-income populations who have a hard time keeping their homes cool, outdoor workers, athletes, kids playing outside, they tend to be more exposed. Since mid-century, we've had about a little over 1 degree centigrade or 2.2 degrees Fahrenheit average increase. And what's that meant here locally is a dramatic increase in days with a heat index over 90. And going forward, we're going to have so since 1970, we've had an increase. I've seen some people say it's like 50 plus days and others saying 70 plus days. So a lot more days with a heat index over 90. Going forward, we're going to see dangerously high heat, dramatic increases in days with a heat index over 100 and over 105, close to 3 months a year by mid-century for heat index over 105. And of course, it is getting hotter, not only because of climate change, but because how we develop as cities. More concrete and asphalt built materials, less vegetation, less tree canopy, more waste heat from our buildings, from our vehicles. All of this contribute to making cities up to 10 degrees hotter than the surrounding areas. And this is something that we can really work on locally to mitigate as well. And it is not equal in terms of where those impacts are felt. On the left, this is just a map of Miami-Dade County, but this is pretty universally true across the country, is that our lower median income areas, on the left, the white boxes being the white census tracts that have the lowest area median income, and on the right is our urban tree canopy, with the white boxes being less than 10% tree canopy. You can see how aligned they are. And in your world, we look at compound risks, and certainly a hurricane with a widespread and extended power outage, or any reason we get an extended power outage during a time of high heat, can be very dangerous for our communities. Generally, Miami has pretty high AC penetration, but during these times, it can be very dangerous. And we saw this in 2017 with Hurricane Irma, where we lost 12 people in the county just north of us in a nursing home due to loss of cooling. One of the ways we wanted to better understand who and where people are at risk, we looked at the emergency department visits and hospitalizations by zip code in the county in that same 5-year period, 2015 to 2019, pre-COVID, and then looked at what were the strongest correlating factors. And high poverty rates, high land surface temperatures, or our urban heat islands were the top correlations, then followed by outdoor workers and families with children. So we've been able to map that. We can target our interventions in those areas. The Deep South area having very high percentage of outdoor workers and high poverty rates. The sort of Central North area, high poverty rates and very high urban heat islands. All communities now, the CDC has a new heat and health risk tool that may not have the actual heat-related emergency department visits and hospitalizations, but it has mapped some of these typical vulnerabilities, so you can too do better planning about where people are most at risk. And to just give you a sense of scale of how much more vulnerable, the areas that are the deepest red or rated 4 or 5 in vulnerability on this map are experiencing 4 times the rates of emergency department visits and hospitalizations than the light yellow areas, or even the light orange, the 1 or 2s. So it's a big disparity in terms of what we're experiencing. So that kind of data helped inform the creation of our plan. Also, we wanted to make sure we got a lot of diverse input to create our plan. So I co-chaired a task force with the woman featured here. This is Dr. Cheryl Holder. She's an internal medicine doctor that spent her career working in vulnerable communities and is a co-founder of the Florida Clinicians for Climate Action, and has been a big advocate for vulnerable communities as it relates to extreme heat. We also had members from State Health Department, the National Weather Service, our internal departments, our municipal partners, and university and community-based organizations. And we did a series of 6 public workshops focusing on different aspects of extreme heat, from streets and trees, to housing, to emergency preparedness and response, to communications and outreach, data and research, each gathering both what were the pain points, but also what are people recommending that we could work on together in a sort of collective action strategy to address these increasing risks. And all of these are just a representative of some of our partners in the plan itself that have been a part of implementing solutions. They also gave input to the plan. Our plan's goal is organized around three main goal areas. One is to inform and prepare people. And that's really short term. How do we make sure people know about the risks and know what to do to prevent them and how to respond if they're experiencing heat stress? Two is to cool our homes, help people stay cool at home affordably, and to make sure our cooling sites or resilience hubs have that backup power we need in the case of power outages. And then finally, cooling neighborhoods is that urban heat, that long-term strategy of preserving and enhancing our tree canopy, emphasizing the importance of cool roofs, cool pavements, pervious surfaces, green infrastructure in general. So in detail, the goal one, we declared, because in Miami and in many of your areas, really, we have chronic high heat and humidity. So we declared May 1st through October 31st as an official heat season. And we communicate that any day during that time, it can be at risk. People can be at risk. And you can see in the photo here is just one of our billboards, but we've done simple messaging on bus wraps, bus shelters, digital ads in gas stations, in medical offices, radio, social media, multiple languages, but also messaging to particularly targeted populations, not just general, we do general, but also to outdoor workers, to pregnant people, to people with no and low cost ways they can stay cool at home affordably. We've worked with the National Weather Service on updating and lowering our heat advisory and warning thresholds, and with emergency management on our response protocols. Worked with the outdoor worker protection. I can talk more about that if people have questions. And then we have a robust partnership with our universities on ongoing research. These are just some of our materials we're happy to share. We were able to partner with NOAA to sort of stress test the plan and further enhance our protocols. That really helped us get to the updated thresholds with the National Weather Service. And led by emergency management with guidance from my office and in collaboration with our partners, the Homeless Trust, our 311 and communication staff, and the sites that serve as our cooling sites, our parks, our libraries, our internal services department. We put together updated protocols for heat advisories and heat warnings to make sure that we are messaging where people can go to cool off, and that there is specific outreach to people experiencing homelessness to make sure they get access to a place to cool off as well. Another thing we did to partner with our emergency management department was a series of trainings. Last year, it was heat safety specific for community-based volunteers, but this year we've extended it as extreme weather trainings. These were designed similar to a CERT training and also offered to our CERT volunteers as new continuing education. But it's training people on knowing how to prevent heat-related illnesses, what the signs are, how to respond in the event of heat cramps, heat exhaustion, heat stroke. And we offering those in English, Spanish, and Haitian Creole. We're happy to share some of that materials if anyone's interested. We also partnered with Florida Clinicians for Climate Action and Baptist Health on a series of trainings for healthcare practitioners, done trainings for the homeless outreach staff, summer camp, cooling site staff, and for employers on how to create their own heat safety protocols. Sort of medium term, our county has upped funding to help people stay cool at home affordably. We installed 1,700 efficient AC units in public housing last year to make sure that everyone under the county's care had access to affordable cooling. But we've also, the county has added funding for the weatherization program to further supplement the state or federal and state funded weatherization program, as well as provided more comprehensive housing rehab programs. And we've provided more resources to homeowners to know the different resources they can access to retrofit their homes to keep their utility costs down while also staying cool. We're exploring indoor cooling standards, and I already mentioned the Resilience Hub / Cooling Center grid resilience plan. Oh, sorry. So urban heat island mitigation, we're actually looking to release our draft urban forestry plan next week. That is a plan to get from 20% tree canopy to 30%, focusing on the areas that need it the most. We've created a partnership with our public school district and with faith-based organizations who both own collectively much more land than the county in the areas that we need it most, and have upped our investments, installed 250 bus shelters to help with cooling people's commutes, and are doing ongoing urban heat island monitoring. Our website and my contact information is there. I welcome anyone's follow-up and question, and you can sign up for our newsletter. I believe we're going to do the presentations all first, and then we can have questions later, but correct me if I'm wrong, and I will stop sharing. Thank you.
Thank you so much, Jane. And we will now go on to our next presenters, Kimberly and Donald.
Thanks, Matt. So I hope you can see my screen. Okay, thanks, Jane. So thanks, everyone. And great to follow up after Jane and her very, very poignant talk. I want to just reiterate that heat is the #1 weather-related killer in the United States, and studies show that heat waves are becoming hotter, lasting longer, and becoming more frequent. In fact, 2023 was the hottest year on record since global records began in the 1850s, and 2024 is already off to a hot start, as you know. There's a 50% chance that 2024 will rank as the warmest year on record, and a 100% chance that it's going to be in the top 5. And the Associated Press did an analysis of CDC data, and they estimated more than 2,300 people in the US die of heat-related illnesses last year, and the most in 45 years of record keeping. So that's an increase from about 1,700 and 1,600 heat-related deaths that were reported in 2022 and 2021, respectively. And these are not just statistics. These numbers reflect a rising threat to our health and safety. So as Jane also mentioned, there are disproportionately impacted populations. No one's immune to the impacts of heat, and these higher temperatures are leading to increased risk of respiratory illness, heat exhaustion, heat stroke, and heat-related mortality. Extreme heat doesn't affect all people equally. It disproportionately affects those living in urban areas, very rural areas, pregnant people, older adults, children, athletes, people with disabilities or chronic health conditions, lower income families, people who work outdoors, and many more. So extreme heat also impacts infrastructure. In the 2021 Pacific Northwest heat wave, roadways and sideways buckled, railways warped, public transportation was shut down due to lack of air conditioning, and increased energy consumption needed to air condition homes and buildings led to some power grid failures. So our mission at the National Weather Service is not just to forecast the weather, but to ensure that Each one of you, our partners and users, is equipped with the best tools and knowledge to mitigate these risks. So today I'm going to demonstrate our newly expanded Weather Service heat risk tool, which can help you measure and communicate the potential severity of upcoming extreme heat. Now, this tool, heat risk, is a result of a longstanding collaboration with the CDC and National Weather Service, and our two agencies work together to identify temperature thresholds and develop a service that contextualizes heat forecasts with data and methods that are relevant from a public health perspective. The Weather Service integrated heat health temperature thresholds provided by the CDC with local temperature parameters to devise heat risk. And heat risk is the first multi-tiered framework that applies a consistent approach across different climate regions, incorporates high-resolution climatology and locally relevant health evidence, and provides decision makers with a heat service that's easy to use and yet appropriate from a public health standpoint. So heat risk uses the National Weather Service temperature forecasts and climate data, as well as CDC heat health data, to place the extreme heat that's forecasted into a climatological context and identify upcoming heat events that will lead to increased heat health impacts. Now, heat risk, you can see here, is divided into 5 simple numeric and color-based categories for each 24-hour period out through the next 7 days. And it provides a spectrum of potential heat-related impacts. So if you think of analogies like the air quality index or the ultraviolet index, it really expresses complicated information in an easy to understand color number approach. And heat risk complements our other Weather Service heat-related products like the heat index and the wet bulb globe temperature, as well as our watch warning and advisories. But it's especially useful in providing critical heat guidance to people and groups potentially most at risk to the heat. Now, heat risk takes into account how unusually warm the temperatures are, the time of year, the duration of the heat, and if there are if there's any overnight relief, and if the temperature is high enough to pose an elevated risk for heat complications based on that CDC heat health thresholds. So we'll do a little more in-depth look at the 5 different categories. The worst category is extreme. It's colored magenta and numbered level 4. And this category accounts for rare, long-duration, extreme heat waves that have the greatest impact throughout our communities, including an extreme risk of heat-related deaths and illnesses. Now, these events will stress the local infrastructure and resources to adequately respond. And low temperatures will remain excessively high relative to climate, in addition to daytime temperatures, meaning there's no overnight relief from the heat. Our next category is major, and it's colored red, number level 3. And these will also be highly impactful events with a major risk of widespread heat-related impacts, including heat illnesses and mortality. But the duration or intensity is just a little bit less than a magenta event. So both magenta and red events represent roughly the top 5% of hottest days and nights in the climatological reference period for a location. It's important to note that at these levels, heat-sensitive populations will be disproportionately affected by the heat, but this level of heat will also affect the majority of the general population who don't take proper precautions. As we move down the scale, moderate is colored orange and number level 2. And for most people, this heat will be uncomfortable, with heat-sensitive populations experiencing the majority of significant impacts. And it's important to keep in mind that orange values of heat risk still mean that there will be some heat-related impacts, especially during the peak heat of the day. Additionally, it's important to note that otherwise heat-tolerant individuals can become heat-sensitive if they don't adequately hydrate or stay cool during that peak heat of the day, such as attending an outdoor venue or participating in strenuous outdoor activities. Now we go to the minor category, which is colored yellow and number 1. And this is the lowest level of elevated heat risk and is likely to impact only the most exposed and heat intolerant individuals or systems. Then we have a level green of heat risk, which is a base level 0, and represents that there's no expectation of heat-related impacts. And the heat risk has actually been utilized out west for almost 10 years, and this is probably from the same report that I think Jane mentioned earlier. But Maricopa County, Arizona, where the majority of the Phoenix metro area resides, saw 645 heat-related deaths last year. And performing an analysis of the percentage of deaths that occurred in each of the heat risk categories, we see that 52% of their heat-related deaths occurred on days where heat risk was extreme, and another 15% on major heat risk days. So this really indicates that heat risk has the utility to identify the days where the greatest risk of heat-related impacts occur. But I do want to note that heat risk has many advantages. It's not the only tool in the toolbox. Heat index and wet bulb globe temperature are still used by our partners, decision makers, and the general public to varying degrees. And there's no silver bullet for heat. All these tools should help inform how to prepare for heat based on user needs. And each of these tools plays an important role in communicating heat, as do our maximum and minimum temperatures. And with that, I will pass it over to my colleague, Donald.
Thanks, Kim. So that's a perfect segue into some of the stuff that we're doing here locally at the National Weather Service in Miami. As Jane had mentioned, in partnership with the Heat Task Force, we lowered advisory and warning criteria for our heat products by about 3 degrees across the board. You can see the criteria there. And we've created a heat graphics webpage where counties can come to a county-based Zoom of their local area and look at all of the different indices that we just talked about, from heat index, wet bulb globe temperature, heat risk, and as well we produce graphical hazardous weather outlooks that, hey, maybe we're not reaching those heat advisory criteria that we have, but heat is a concern. And really the graphical hazardous weather outlook is our vehicle to take all the different indices, bring them together, and come up with a unified threat. But each index has its strength as when we consider which communities we're trying to target with our heat messaging. Maybe there's a race, and wet bulb globe temperature would be more important or appropriate for somebody who's exerting themselves in the heat, or maybe it's the vulnerable communities and heat risk might be more applicable. So presenting all of this data for our customers to be able to see what's appropriate for them is important, and why we're developing some of these pages. And in addition, we're developing probabilistic web pages as well. So it's not just this is our temperature forecast and this is what the heat risk is going to be. We can start talking a little bit about, yeah, what's the probability though that our temperature forecast may be a little low or high? And if it is, then what are the impacts going to be? You can go to the next slide, Kim. So what we've gone and worked on up to this point is comparing heat index with wet bulb globe temperature. And we're going to take that study a little bit farther now and replicate some of what the Weather Service as a whole has done with heat risk with the CDC, and start to look at the emergency room visits. As Jane had mentioned before, we've recently partnered with the Florida Department of Health to be able to get that data so that we can look at a local level. There's several observing sites in the map on your bottom right there, WeatherStem, that actually calculate wet bulb globe temperature. Not all sensors across regions do. And so what we're going to do is we're going to mimic the study for heat risk with wet bulb globe temperature, and hopefully come up with some thresholds for all 3 different categories that apply hyperlocal to the different counties, so that we can tailor our graphical hazardous weather outlook, so we can tailor our heat page to adequately represent the threats based on the data, so that our partners are able to make the decisions that you heard that they talked about earlier, whether it be heating and cooling stations or taking precautions for workers outdoors, so that they have the most information and the most scientifically sound information available to them. And that's all I had. Thanks.
Thank you all. Like I said, now is the Q&A portion of this webinar. If you have any questions, feel free to add them to the chat. We do have a question already from Brian. What data do you have on the impact of persons with disabilities in extreme heat? That's open to any.
Yeah, I'll start. We do know that people with spinal cord injuries can be more at risk with heat exposure. And then it really, disabilities can make it difficult to get to solutions in time. So it's important that we get messaging out to them as early as possible. I had one story of a woman was in a wheelchair and waiting at a bus stop, and the first bus that came couldn't accommodate a wheelchair. And then she had to wait that much longer, and that being some of the challenges that people with disabilities can face. But I don't have good, research data. But I do know that people with spinal cord injuries are more sensitive.
Yeah, I'll just add to Jane's comments. I saw a wonderful presentation by Sherman Gillums at FEMA headquarters on people with spinal cord injuries and how they're kind of the canary in the mine when it comes to heat. But I don't know if we actually have it. If not, we're definitely working towards it on heat.gov. There is information on at-risk groups and populations. So there may be more information specifically on people with disabilities and percentages of heat-related illnesses and heat-related mortalities as well. So I apologize if it's not there in advance, but after this, I will go and check and I will make sure we get it on there.
Thank you all. We have another question on kind of on data on additional heat risks for unhoused people. Is there any kind of, any of the research or any experience with working with unhoused populations and on their heat risk?
So Maricopa County, of those 650, I think it was close to half were people experiencing homelessness or unhoused. It was a very high percentage. It's not as high in Miami-Dade County, but that's because of our unhoused population. We have a much smaller, we have a much smaller total number that are living on the street. So, and we don't have, we have the high heat and humidity, whereas they have that extreme high heat that can make even surfaces dangerous, that can maybe have a higher impact on that population. But we don't have specific data for ours. We just know it's in general lower.
Yeah, on that note, and I think, Jane, you kind of mentioned it earlier when you were talking about zip codes in the data sets. It's kind of limited. We have sensors all over the place where we can check temperature, but being able to target exactly why somebody was checked in for heat illness is quite difficult. And the zip code doesn't necessarily mean that's where the incident was either. And so these are all issues in the data to overcome. And while we're trying to pull out everything we can, it can be difficult at times just based on how it's reported.
Yeah, data is definitely a huge challenge. Understanding that situational, how many are in the home, how many are unhoused, how many are at work, kids playing outside, all of those recreational type injuries, we don't have good sense of what those percentages are.
Yeah, it seems we have a lot of questions about, getting specific data in here. We have another question about how, have you seen any data on how increasing the canopy and shade in densely populated areas has helped? And kind of, have you seen kind of the measurable impacts of that?
So we do know that our areas of lowest tree canopy are also our areas of highest heat-related illnesses. Well, we haven't been around long enough to be able to monitor the impacts, because we're upping our tree planting now, but it could take 5 to 7 years before that canopy fully grows out, and then to monitor the health impacts of that. We just haven't been looking at this long enough to be able to have answers on that. We just know there's a strong correlation between low canopy and high heat-related illnesses.
And I'll mention that some of this may be able to get pulled out of the data when we start comparing wet bulb globe temperature to heat illness as well, because that's a measure that's taken in direct sunlight while heat index is in the shade. And so I believe there is a forecast office in Texas that went to a outdoor venue with their emergency management team with a wet bulb globe temperature sensor, and walked around where they were going to have lines for people waiting to get in, and gave some advice as to where maybe lines could be moved, where they would have more relief from the sun, and some shaded areas. So once we correlate some of the wet bulb globe temperature data with the heat illness, we can start to see how shade versus direct sunlight may have a direct impact and get some more data, whereas heat risk, which we were talking about a minute ago, doesn't necessarily take into effect shade or sun quite as much as the wet bulb globe does. So,
Yeah, and I'll just add that not necessarily intuitive, but if you're out in the sun and you get a sunburn, that actually reduces your body's ability to tolerate heat. It reduces your body's ability to regulate heat, because if you think about it, you have a sunburn and you touch your skin, you're already hot, and that can then make it more likely to get other heat illness, heat exhaustion, or heat stroke.
We have a question about outreach. Kind of, they wanted to know what types of dissemination channels and what has been successful in your outreach campaigns about messaging with extreme heat.
We asked people who were from the communities that are most vulnerable to tell us where they got their message, where we need to, who did they get their messages from? So one is, medical professionals, doctors and nurses are the most trusted messengers in a community. We wanted to make sure we gave them, particularly in the clinics, medical offices that are serving the most vulnerable populations, had materials, resources, digital signs in multiple languages to message to those people what the risks were. The radio stations, the Creole radio stations that they listen to, the different ways that people listen, we wanted to make sure, and the outdoor media we're doing in those zip codes that are having the 4 times the rates of heat-related illnesses. But then in addition to medical professionals being trusted messengers, that's really the importance of this partnership with our emergency management and community-based organizations in doing those heat safety trainings for community-based volunteers. Because the more people from their community, their neighbors, their coworkers, their cousins and loved ones give the message, it's a lot more impactful than a government message. So those are some of the different strategies we use.
Yeah, and on the local weather service side of things, some of these tools like heat risk and the interfaces that have been developed for them are very helpful for us for when we're not reaching our heat advisory criteria, but we still need to message a heat risk. And I know that sounds not so intuitive. You know, we're in the process of changing how we do things. Heat index has been around for a very long time. Everybody's set their criteria on that, and it takes time to change those well-established thresholds. So we've done some small step towards that, as we talked about a little bit. But we do realize that people are experiencing heat impacts outside of those advisories and warnings, and having a social media presence where we can send out information about heat risk if we know that it may be a day that affects vulnerable communities prior to us really getting all of our heat advisories in line with some of these new thresholds and figuring out what's the best way to message that to the public as a whole. You know, we use our social media to message that and send out briefings for upcoming heat threats to our county and city emergency management officials for their preparation and just general awareness. So we're on the social media side mainly, and then communicating directly with our state, county, and city partners.
And from the national level, as part of the National Integrated Heat Health Information System, which is a conglomerate of federal agencies working towards building a heat resilient nation, we do also rely on social media campaigns. We have an early season heat safety social media campaign that occurred towards the end of April. We are kicking off our mid-season campaign beginning of next week. And it's going to go for 5 weeks, but each agency is kind of divvied up into different days of the week, and each day of the week has a different theme. So it's more of a, instead of a big push, it's a reminder throughout the rest of the heat season that, hey, heat's dangerous. You got to be prepared. And then we're going to actually do a late season campaign based on partner feedback of, there are times where you get that cold dip in the beginning of September, and then they forget it's hot and you get another heat wave. So we got to remind them that heat can still be dangerous even if you've had some cooler temperatures. And to add to that, I would just say that a couple of things we're starting to adopt is especially with hurricanes, there's the check on your neighbor messaging. Well, we're trying to push that with heat, because a lot of the people who unfortunately perished in like the Pacific Northwest heat dome were older adults who were socially isolated. Same thing again after the June 2012 derecho that affected the Mid-Atlantic. It was large power outages, and unfortunately older adults who were socially isolated were the ones who were the bulk of or bore the brunt of the impacts.
And speaking of power outages, someone's asking, especially with, kind of the news of Houston with dealing with power issues, do you have any advice for people dealing with heat during a widespread power outage, or after a disaster?
I would say that and it kind of goes to the messaging, right? We're trying to let people realize you can prepare for heat. You can have an emergency action plan for your individual self and your family. And, whether it's making sure that you have good window treatments to cover and block out the sun, having a cool place to go, even if it's going to the mall or calling up your friends, being like, hey, is your AC working? And making sure you have plenty of bottled water. So one thing that the Houston office actually did in light of Beryl with the about 2 million power outages is they lowered their heat advisory criteria. And that's why I think it's really important to have people like Donald at the local WFO being able to adjust the criteria as needed on the fly when there are really impactful events. And hopefully working with partners, which there's great relationship in Miami, to let people know, hey, the cooling shelters are open, or, dial 311 to find out where the nearest resilience hub is, et cetera. I don't know, Jane or Donald.
Yeah, no, thank you, Kimberly. Great broader perspective. So yeah, locally we quickly will have information on which of our cooling sites, which of our evacuation shelters still have access to cooling. So we would be messaging that out to the public for that. But to Kimberly's point, it's also friends and family, what resources you have in the neighborhood. Those may be more comfortable places for people to go, and all the passive cooling strategies that Kimberly also mentioned is so important, because there are so many strategies you can do, whether it's putting water on yourself and fanning, the window shades, only opening windows in the coolest times and then closing them during the hottest times of the day. All these can help with minimizing the impacts of that.
Thank you so much. We have a couple more questions. This might be more for Jane on one of the slides mentioned CERT. How do you see kind of CERT's role in a kind of heat response, or what would CERT be doing in that situation with extreme heat?
Yeah, thanks. So Kimberly mentioned that social isolation being such a key piece. So checking on neighbors, getting their teams. We have not all our volunteers are organized into teams, but if they are, some of them will have this whole call tree and they know who to check on. If you can get that organized, that's like really the gold platinum standard. But as individuals, to think about their networks of where they can go to make sure vulnerable people are checked in. We also, CERT volunteers often help support major festivals, events, outdoor festivals, events, whether it's athletic events or concerts and parties. All of these are if they happen during higher heat times, those we can have a lot of incidences, and our CERT volunteers can support with the relief efforts. We have tents set up with equipment, et cetera. So there are various ways to engage the CERT volunteers in that.
Thank you. Maybe one or two more questions. So I had a question on, what successful strategies for reaching Latinx populations or those who do not speak English as a first language. They've mentioned that there's a lot of stories kind of about how non-English speakers are at particular risk. Do you have any successful strategies, or what have you all done to reach those communities?
All the messaging we do, we also do in Spanish and Haitian Creole. We reach our, we're pushing out through those radio stations. We do social media in those languages, targeting people who are speaking those languages in the zip codes we need to. And that's also why we do our community-based trainings, also not only in English, but in Spanish and in Haitian Creole, so that we have native speakers who are from those communities who can be part of that messaging.
At the Weather Service level, and also here locally, we've partnered with private companies to work on some machine learning capabilities to translate our English products and have them housed. That's being done a lot with our tropical products right now, but the goal is to extend that to all of the products that we issue through the Weather Service. It takes time to build that database to be able to have representative translations. But down here locally, we have a Spanish weather radio transmitter. So if anybody were to be actually listening to the weather radio, some of our products are transmitted in Spanish with a crude dictionary for a translation. So it may not be as great as what the future will hold, but some of our highest impact products we do at least have an audio broadcast of them in Spanish. And we have several Spanish speakers in our office who tend to tailor the graphics towards the Spanish-speaking community. But that certainly doesn't target all of the different languages that are spoken down here. But there's work being done to make sure that our messaging at least can reach pretty much any language.
And I just want to make a plug for the translation services that Donald was talking about. It's weather.gov/translate. We're working to expand the number of languages and to include all our products in there. But as Donald said, it's machine learning and it takes some time. We do also have some information available on heat.gov, planning and preparedness tab. There's an Espanol section and has links to a lot of information resources in Spanish. And then our weather service, for our infographics, anytime we create a new infographic, it is always in Spanish, if not other languages as well.
Thank you. Just one more question. A lot of people are asking about kind of where are great places to reach information on like a heat relief planning list or any websites. Is this a great, for heat.gov?
Heat.gov is amazing. They've done so much great work. I go to it and it's always new tools coming out. And they will be creating even more for particularly local governments to do planning. So that's my first stop for sure.
I just want to say thanks, Jane.
Yeah. No, you guys have done a great job, and you're continuing to work on it, so it's good.
I just wanted to say, thank you all to our presenters, Jane, Kimberly, and Donald. I think it's been a wonderful webinar. I certainly, learned a lot. And I hope, all of you all did too back out there. And I did want to, before we go, share that, we do have another, webinar coming up that it is, breaking barriers and creating community and empowering rural and residents through improved information delivery. I know it's kind of a long title there, but it's a really great presentation. We have people back here at FEMA that have been raving about how good this presentation is. It's with the Georgia Southeast Health District, and that is August 13th. 2 p.m. Eastern, 1 p.m. Central Time. So we hope to see you all there. It's really talking about, how can we really reach those rural audiences and make and do messaging with, information delivery. It's a great presentation. So we hope to see you all there. This webinar can be found on the Mississippi-Alabama Sea Grant Consortium YouTube page, which will be in the chat for the link to there. And if you have any more questions, feel free to reach us at our FEMA Region 4 Stakeholder Relations email. If you need anything, let us know, and we'll try to answer as soon as possible. And we hope you all have a wonderful rest of your afternoon. Thank you so much for attending.